Hi, this is Justine, EMDR therapist. So today I'd like to talk to you a little bit about how I use EMDR in therapy. So, eye movement desensitization and reprocessing, EMDR, is a psychotherapy approach designed for working with distressing or traumatic memories. The theory behind EMDR is that many psychological difficulties are the result of distressing life experiences which have not been stored in memory properly and are said to be unprocessed or blocked. These traumatic memories may need some help to become processed, and EMDR is one way to do this. What is special about trauma memories? Normal memories are stored by a part of the brain called the hippocampus. You can think of the hippocampus as a sort of librarian which catalogues, processes events, and stores them in the right place. However, some traumatic events, such as accidents, abuse, disasters, or violence, are so overwhelming that the hippocampus doesn't do its job properly. When this happens, memories are stored in their raw, unprocessed form. These trauma memories are easily triggered, leading to them replaying and causing distress over and over again. What will I be asked to do in an EMDR session? There are a number of steps to EMDR treatment, but some of the key stages are: think of a troubling memory, then identifying an image of the worst moment of that memory. So thinking about the worst part of that experience for you. Think about the image and a belief while at the same time thinking about the worst part. So what was the worst part of that memory and the belief that goes along with that? And the belief could be, I'm not good enough. I couldn't help. Why did it happen to me? You identify a negative belief about the worst moment and also thinking about what that does to you emotionally. So, thinking about the emotions that go along with that belief. You also think about the image, the belief, and at the same time, you do the left to right eye movement. So, your eyes are also supporting you to process the trauma. So, an EMDR therapist will ask you to move your eyes from left to right while you're thinking about the worst part of that memory, the belief that goes along with that memory, and maybe the feeling that you have about that memory. And that's basically what EMDR is about. It's about using eye movement to reprocess trauma, to reprocess difficult memories that haven't been processed. So we're allowing the mind to go wherever it wants to go and just notice what comes up. This process will be repeated until the memory causes less and less distress for you. So why do I need to make the eye movement? In EMDR, you are asked to pay attention from one side to another while thinking about your memory. One way to pay attention from left to right is to follow the therapist's fingers as they move it from side to side. Alternatively, versions of EMDR ask you to pay attention to sounds or tapping or using what we call the butterfly hug, when you gently tap yourself from side to side. What is EMDR used to treat? So there is very good evidence to show that EMDR is an effective treatment for post-traumatic stress disorder, PTSD. It is also recommended to treat anxiety. It can also treat some forms of OCD. It can also treat any sort of distressing memory that you have that may not be PTSD, but it's still really distressing for you, EMDR can treat many different forms of distress and anxiety. The EMDR protocol has 8 phases. So the first phase is treatment planning. And that's when we're going to take a real detailed look at the reason why you've come for EMDR. We're going to go back. We're going to take some information about past traumas, events, the things that have happened, things that you'd like to work on through the EMDR process. So we're looking at the client's history. Phase 2 is preparing the client. So making sure that the client has all the information about EMDR, is completely happy with the process and understands what might take place while we're working through with EMDR. So it's really about psychoeducational, just giving a brief overview of EMDR and the things that might come up for you while you're processing your past traumas or stressful events. Phase 3 is the assessment phase. And we're going to be looking at specific memories that we're going to target, that we're going to process while we're doing this work. So the client is often asked to focus on a distressing image, a negative thought, and also incorporating the sensations in the body that comes along with that. Phase 4 is desensitization, and that's when we use the bilateral stimulations within the process. So this is when me, the therapist, would use the eye movement within EMDR. Phase 5 is installing positive beliefs. So we want to replace any negative thoughts, any negative beliefs that you might have around that event, and we want to try and replace it with a positive belief, a positive thought, rather than the negative one that you might have at the moment. Phase 6 is a body scan. So we're looking to identify and address any residual physical tension or discomfort that's related to that traumatic memory and that is still in the body. So we're doing a body scan to really kind of look at what's happening for us in our body as well. Phase 7 is closure. And that's where we kind of stabilize and make sure that we've concluded the session and that the client is feeling strong enough and can use some of the techniques that we have used within the EMDR process to keep themselves safe. And phase 8 is reevaluation. And then we're just looking at the effectiveness of the treatment after we've completed this and how the client might be feeling about the process, and also looking at what we might work on next. So if there are any additional memories that we need to target, this is the time that we can then start to work on that.